Hi, my name is John Gibbons and I run a company called the John Gibbons Body Muster Method, and you can see it's a combination of many courses. Today we're going to talk about anatomy series, and then we're going to look at the ankle and the foot, because many people keep asking me, John, can you run an ankle and foot course? So I think we'll start with some anatomy components with this fascinating structure. A lot of people struggle with this concept. Why? Probably because there are so many bones, so many ligaments, and so many muscles that obviously allow this to move. So I think we'll start with the bones of the ankle and foot complex. We've got 26 bones in total, and we've got 14 individual phalanx bones, which are the phalanges. So we've got the proximal along here, we've got the intermediate, and we've got the distal phalanx bones. On the great toe is actually called the hallux, and we've got two. So we've got the proximal end and we've got the distal end. So we've got the two bones on this side. We've got 5 metatarsals along here, and then we've got 7 tarsal bones. So we've got the main one, which is the calcaneus along here. We've got the cuboid bone. We've got 3 cuneiforms. This one would be the lateral side, and then the intermediate, and then the medial. And then we've got the bone called the navicular, which is similar to the scaphoid in the wrist. And then we got the talus, which sits underneath the distal part of the tibia, which is known as the medial malleolus. And then we've got the distal part of the fibula, which is called the lateral malleolus. And this will be the main bones. But let's look at some of the bony landmarks. I think we'll look at the lateral side first. So this distant end here is the lateral malleolus, and then coming off that, you can't see it that well, but we've got this bony landmark called the peroneal tubercle coming around here, and then the peroneal tendons are held in place, and we've got peroneal brevis that will come around and go on to the 5th metatarsal, and then peroneal longus will come around, and actually there's like a little pulley system here that the peroneal longus will go around the cuboid bone and come right over to the 1st metatarsal. So it comes right over here, and that's where the cuboid will sit. This is the posterior part of the calcaneus, where the Achilles tendon will attach. There is a condition where we can get tendinopathy, we can get a periostitis or even a tenoperiostitis. On children, boys in particular, between 8 and 12, there's a condition called apophysitis calcaneae, and that's typically known as the Sever's disease, named after James Sever, who was an American surgeon. Coming on the medial side of the calcaneus, we've got this shelf. It sounds rather long, the word, and is called sustentaculum tali. And part of the tibialis posterior tendon will attach over to this area just here. Directly above it will be part of what we call the subtalar joint, and that's where the talus bone will sit on. So the subtalar joint is what I call the fine tuner in the ankle and foot, because basically it will control the pronation and supination. So for instance, if a foot is relatively neutral, then we have the foot with a natural arch underneath it, and we call this a pes rectus. And then if a foot flattens so it collapses, we will call this a pes planus. And then if you have a high arch, so it's right over, almost like supinated, then we'll call that the pes cavus. And the subtalar joint controls how much pronation or supination we have, because basically if we pronate at the subtalar joint, then the pronation is a combination which is called triplanar, and we have what we call dorsiflexion, and then we've got abduction with eversion, and then supination is where we plantar flex and then we invert and adduct. Okay, so it's actually, the movement is dorsi and plantar flexion at the ankle. You can't really see it that well in this one, whereas the abduction, adduction, eversion and inversion is from the foot. So when we pronate, it's a combination of ankle motion and foot motion. So it's a combination of the two complex here. Moving on, this is the navicular tuberosity, this bony landmark, and again the tibialis posterior will come directly onto that area in here. And then tibialis posterior will come behind, and then it forms part of a tarsal tunnel complex here. And the tarsal tunnels is known as Tom, Dick and Harry. And then they were named from the Great Escape from Big X, who's Robert Bushell. So they actually tried to do the 3 tunnels. So the Tom was the larger tunnel, and then the Dick and Harry were the decoys because they wanted to get everybody out. And then, so the Tom is the tibialis posterior, which comes round. And then, so that's T, and then the Dick is the flexor digitorum longus, which comes round to the digits. And then you've got the flexor hallucis longus, which obviously relates to the hallux, which is the great toe. So flexor hallucis longus will come round and attach and flex the great toe. So the Tom, Dick and Harry will be where the named tarsal tunnels are located. Just thought you might find that of interest. Further down, we've got what we call the first ray, which is a combination of the hallux and the first metatarsal here. So they call this the first ray. And then directly underneath that, we have got the 2 bony landmarks just here. And these are known as the sesamoids. And these 2 sesamoid bones, like the patella is a sesamoid, these will grow within the flexor hallucis brevis. So there are some of the main bony landmarks. We've got the cuneiforms, which we can palpate. So we've got the first and the second and the third, or the medial, intermediate and the lateral cuneiforms. So there we've got the bony landmarks of the foot and ankle complex.